including more than 700 doctors and nurses. And today, the Chinese doctors are offering the free treatment here. This is also to celebrate Chinese Doctors' Day. Last month, this team of doctors and nurses came to Zanzibar and started their work. It's been more than 1 month. And this time's free treatment is the first here. It's the first of this team, but it's not first ever here because it's common. For this new team of doctors, as this is the first time for the free treatment, so what's their feeling? We know that in China it's very common to see the free treatment, but it's rare to see in Africa. So today, our viewers from CGTN can stay in tune with us and leave us messages. You can ask questions relevant to the free treatment, and I will interview some doctors and they will give you answers. Actually, this free treatment started at 5 o'clock in the mornings. But we can see it's still crowded. There are so many patients standing in line. Just now we counted that there were about 200 people waiting here, and there were also cars coming here. Just now we talked with one responsible person who will be briefing to us.
Here is okay. Maybe we can come here. 现在我们请这个当地村子的村长来为我们说一下。
And now let's talk to the leader of the village. We have an interpreter here because they are talking in Swahili. So we have got an interpreter here. We want to ask that how many villagers are there in this village and how many people are here to join the free treatment.
Kuna ambao kijiji chako hiki kinatwanga
kina watu 1136.
1136. 它的村总共有1136
In total, there are 1,136 villagers living here, and many people are here, but he doesn't know about the exact figure because the patients are from 4 different areas. So how many people from your village are here? 60. So there are 60 villagers here from his village. So how did he know about this notice? Did the health department notify them?
Kwanza nilipata taarifa kutoka na wenyewe. Tulikutana hapa wakanipa taarifa, kwa maana hiyo ngenda nikatoa taarifa mpaka kwenye sehemu za misikiti kwenye mambo ya ibada ili wataarifiwe wafike hapa.
He said Ministry of Health notified him and he notified the other villagers. He knows that there will be many people. He come here to see the doctors. Had he ever seen Chinese doctors in the past, and does he believe in Chinese doctors, and what is his impression on Chinese doctors?
Kwanza tunaamini kutokana na kwanza walipokewa na serikali kuu. Kwa maana hiyo sisi tumeikubali hiyo serikali kuu kuwapokea wao kuingia hapa. Kwa hivyo tumeyakubali moja kwa moja kwa kupitia serikali kuu.
他说我们三西巴尔的教
He said that
接受他们，所以
the doctors from Zanzibar introduced the Chinese doctors to them, so they believe in the doctors. The country
好的，非常感谢。
believes Chinese doctors.
谢谢。
Thank you very much.
三腿萨纳，你自己，三腿。是这样的，刚刚我们从这个采访的村长的这个话语当中呢，也是可以
From the
听得
interview,
出，当地的人对这个中国医
we
生
know
是非
that
常
the
信任
local
的
people
因为这个中国
really
医生
believe
其实
in
在
Chinese
桑吉巴尔
doctors
一直进行
because
这个
Chinese
转移过
doctors
程已经有
have
50年
been
了
assisting,
而每一届
have
政
been
府其实
serving
都
in
对
Zanzibar
桑
for
吉巴尔的这些医生会
55 years.
授予各种
So
勋章来表
every
彰他们在
government
当地做出的
from
一个贡
here
献
will
所以首先
award
这些医生是受
the
到了政
Chinese
府的认
team
可其次他们在
to gratitude to gratify their work here. The local government also thanks their contribution to local medical treatment, and the local people also thank the doctors. That's why every time when they are conducting the free treatment, there will be crowds of people. And we can see here writes the vocabulary Wuku. It is the name of this village. And this is the health station of the village. This is the basic health station. In these basic stations, the large public hospitals will conduct treatment here because the conditions are so limited in basic stations. But if the public hospitals come here to treat the patients, there may be cost if the voyage or for other costs. So for the poor people, this process is difficult to be achieved. So we Chinese doctors can come here to conduct the free treatment. This is the welfare for the local people. So the local people will know about their own condition and have in-time curement. Beside me is the poster for today, and these are the Chinese doctors, and they are from 7 departments like the TCM and ophthalmology, surgeon, physician. And later on, we will visit these departments and see what are the illness they will encounter. Please follow me. Dr. Yang, the chief doctor, Mr. Yang. He is the team leader of the 29th medical team, and he is a surgeon. So today, he is responsible for the surgeon department. Let's invite Mr. Yang to talk about today's free treatment. The free treatment has started for 1.5 hours. So what's the situation? We started at 9 o'clock. It's been 1.5 hours. It is accumulated that there were more than 300 patients, and more people are coming. The different departments also have many patients. It is planned that we will finish in the afternoon or by the evening, but we are worried whether we can finish treating other patients. So it's your first time to join the treatment here, to join the free treatment here, because it's just been 1 month. Have you get adapted to the life here? And today's free treatment, it must be different from the one in hospital. Can you introduce on that? We've been trained for 1 year in China. So we've imagined all the difficulties and the situation. But when we arrived here, we found that things are still different. When we arrived at Zanzibar, what impressed us most is their hospitality. We don't feel like we are in a different country, especially in terms of the life. And for the food and other habits, we are getting adapted to it. We can buy things in the vegetable market. These are different from those in China, but we are getting adapted to the local condition, food, and the materials. So the process of getting to know their food is also the process of getting to know their diseases. Yes, they would like to grab the rice by their hands. These are different from China. That's why in Africa, especially in Zanzibar, there are more infectious diseases. There are also diseases in liver and even uterus. But comparatively in China, the life expectancy is longer and the living conditions is also better. So in China, there are more cardiac diseases, but in Zanzibar, there are more cardiac diseases. And here we also see many tumor patients, but it's rare to see tumor patients here. And what's more important is that the investment of the medicine is not too much. We are here in the largest hospital, but there are still limited conditions of the equipment and the medicine because there's a shortage of the medicine and the equipment. We cannot really use the latest technology. From today's free treatment, what's your comment? From today's free treatment, we can see that the scenery is quite beautiful here, and there are lots of people living here. Usually, we go to the Stone City, to the city center of Zanzibar. But actually, if you get involved in Zanzibar, you will find that there are lots of people living here, and there is a need for the treatment because many of them cannot afford the tickets to Stone City or to the big hospitals. That's why there is an urgent need for local hospitals to come to the villages and give the treatment to the patients. If they can find out the disease earlier, this is better. And what you are doing can also help them find out their disease earlier. Yes. Firstly, if we can identify the disease earlier, it's important. And secondly, we need to tell them the knowledge of the diseases, to tell them that when you have a certain syndrome, you need to go to see the doctor, because many people don't go to the hospital until they are very serious. But if you find out it at the early or even the midterm stage, it will also allow the doctors to treat you. Okay. Can you guide us in this station so that we can experience the whole process of the free treatment? Now let's follow Mr. Yang and experience the free treatment. We will enter from that gate. And this is the reception all the patients, including the physician or surgeon or ophthalmology, the people want to see the different departments will enter from this reception desk, and they will be distributed to the certain department. So after this process, there will be a common checkup, yes, to test your blood pressure. And we can see this is the reception, and we can see many people are waiting here. They actually have no knowledge on their diseases, but they can only describe the syndrome of their body. So by knowing their syndrome, the specialists will distribute them to different departments. The reception is quite important. We have 7 rooms today. We have 7 doctors here. So this reception desk can help distribute the patients. We can see there is one Chinese doctor asking them questions. And this is a notebook. On this notebook are the names of the patients and also the information of the departments. Can you introduce on that? We registered the names of the patients, the ages, and the gender, and their departments. This is the task of the reception. Thank you very much. So how many people have been registered on this notebook? It's about 200. And other patients are still waiting for the distribution. Thank you. So after this process, we will go to another room. In this room is where people get the blood pressure tested. For some people, they even have hypertension, but they don't monitor their blood pressure in daily life. When they come here, we even find that the figure of their blood pressure can reach 200. So we really want to tell them some simple knowledge that blood pressure monitoring is quite important. And we can also see medicine distribution here. And what are the medicine for? These are for the hypertension. Because once your blood pressure reaches a certain high degree, you need to buy medicine. We can give them some medicine, but they still need to buy medicine from the other hospital. Hypertension may result in other diseases, just like cardiac disease. Just now we heard from you that there are 7 departments here. Now let's enter in the first room. This is Mr. Zhou from ENT Department. This is the first room. Mr. Zhou is now asking questions. He's now diagnosing. So what are the diseases of ENT department? Yeah, there are diseases relevant to the noses or to the throat or to the ears. This is because the hygiene condition here is quite severe. This time, Mr. Zhou prepared medicine for the ears and the noses in order to meet the demand of the local people. And we can see Mr. Zhou is speaking English to his assistant. But local people cannot speak English because they are speaking Swahili. So are the languages also the barriers for your work? Yes, in Zanzibar, in total, actually English is the official language, but English is only spoken among high educated people. They are taught since they are very young. But the school enrollment is not that high, so most of the people didn't go to school. They cannot speak English. They can understand some English words, but they cannot communicate in English. So usually, our doctors cannot speak Swahili. That's why we have the interpreter, the assistant, who will interpret the English to Swahili. We can see Mr. Zhou is checking the patient. This is at ENT Department. If there is a need for the medicine, are these medicine free? Yes. Yes, because this time we have prepared the medicine a week ago at our station. So we've bought medicine worth of more than 10,000 yuan here. Okay, let's do not disturb Mr. Zhou. And now we are going to another department. That's oral cavity department. And we can see it's quite crowded here. Actually, this room is small, but there are so many people here. We can see Mr. Zhang is sitting here, and his assistant is also here. These doctors are here to serve Tanzania. Apart from their tasks for treatment, they also need to teach or conduct scientific research to help improve the medical levels of Zanzibar. We know that the mission is to build up a team permanently. Yes, Mr. Zhang has been working in the medical field in stomatology for more than 30 years. He stressed the scientific research and the teaching in this department. And once he arrived here, he taught local people, local doctors, and also did research. He wants to help improve local medical conditions, especially the stomatology condition. In future, we also have planned to teach in medical schools. Some of the plans have been implemented, but some of them are still in the planning stage. So we are here contemporarily, so the best choice is to train local doctors. Yes, we want to help improve their own stability, their own capability. Are these problems here similar to that, like the decade tooth? Yes, there are also infections around the mouth. In the past, the average life expectancy here was quite low because people got infectious easily. The people got the inflammation and other infectious diseases easily. And this is also because they would love the candy, the sugar. Yes, they eat few lamb or beef because the price of the lamb and beef are high. That's why they mainly eat the sugar or sweet food.
好的，
It is quite sweet.
就让医生继续进行他的看诊。我们
Okay, let's leave the time to the doctors, and we are going to the next room. The next room will be the
那为什么
busiest.
眼科的诊室会是最忙的呢？
That's the
下去眼科来揭晓这个答案。
ophthalmology department. But why this department is the most busiest
就
one?
是现在我们看
Let's
看到的
go
这个长
and
长
have a
的队
look.
伍，其实都是在排队等待眼科的这
We
个
can
队
see
伍。
this long
刚才这
queue.
个
People
杨队长
are
说了，
lining
我们
up
只要
to
从这
wait
个
to
队伍的
see
长
the
度就能看到
doctors
眼科
from
平时有多忙。
ophthalmology
好，
department.
那我们现在
So
走
you
进
can
眼科去
imagine
了
how
解一下。
busy the doctor is. Let's approach this room of ophthalmology. And we are now in the room of ophthalmology. This doctor is the busiest one. He has a very special family history because 3 generations from his family came here to assist in Tanzania. His mother-in-law and the uncle of his mother-in-law went to assist in Tanzania. So he is the superstar here. Many of the media friends or local people know much about him. The first generation who came here is the uncle of his mother-in-law, who was the leader of one Nanjing hospital. And his mother-in-law went here in 19th generation. And he is here in the 29th team. So he came here voluntarily. Yes. I think there are 2 reasons. Firstly, people want to be the volunteers, and secondly, their families support them to be the volunteers. And for him, he himself is willing to come here, and the support from his family is also important. He just finished seeing one patient. Let's briefly talk to you. There were so many people lining up outside, but why there were so many ophthalmology patients here? Because the X-ray is the ultraviolet ray is quite strong here. That's why people get the eyes diseases when they are very young. And the local people are so poor, they cannot afford the hospital fees. And they are not aware of their diseases. So their diseases get delayed. That's why there are so many people getting the eye diseases. If you find people have the diseases, will you arrange them to receive the operation in public hospitals? Yes, we will suggest them to the public hospital for further checkup. And if their cataract diseases reach a certain level, they will get free operation. As we all know, the conditions in Zanzibar is quite severe. In China, it's easier to control the after-operation infection, but because of the severe conditions here, you need to be more careful so that to prevent the infection after the operation. Yes. We help form the standards for the local doctors. Like, for example, 3 days before the operation, we will offer them liquid so that to prepare for the operation. And we also have other messages so that to control the infectious rates. Before Chinese team came here, their process of the medical condition here, medical situation here is not standardized. We are getting closer to Chinese level, to the situation in China. In the past, they even couldn't conduct the cataract operations, but after Chinese team came here, they can successfully conduct the cataract operation. This is quite important. So in this ophthalmology department, there are doctors who can conduct operation independently. Yes, some of the local doctors can conduct a simple operation, but for cataracts, it's mainly relying on Chinese doctors. But we think in future, local doctors can also conduct that operation. Okay, let's not disturb you and leave the time for the patients. And we are going to another department. We are going to a TCM-related department. That's acupuncture. Acupuncture is a department from the Orient. So is this also welcomed in Africa? Let's go and have a look. And we can see this is Acupuncture Department. There is one patient sitting here and receiving the treatment. It's been 2 minutes. Mr. Zhu, can you briefly introduce the TCM and the acupuncture in Zanzibar? Do people here believe in the department? Hello, I'm Zhu Weijian from the 29th Chinese medical team to Tanzania. Let's introduce the TCM and acupuncture here to you. After the promotion and efforts of Chinese doctors, we have won a good reputation locally. So many patients also want to choose acupuncture to cure some bone aches. We also know that many of the government officials from Zanzibar also believe in Chinese medicine. Yes, they themselves or their families will come here, and especially for people who have the arthralgia, because they really believe Chinese team, and we also got good results. This is also kind of promotion, and the generation from generation with one good reputation locally. And dear assistant, can you help me interpret? Mm-hmm.
He's feeling good. So what is his problem? Why he come here for the acupuncture?
Hip muscles pain.
就是这位病人，其实他是大腿和连带着腰腿这个地方是吧？引起的。
So he got pains on the ham and the hip, and also wrist. So he is receiving the acupuncture.
For those needles. 对。就是说他已经不害怕了，是吗？
He doesn't feel afraid animal.
For the first time, he's afraid of it. Why is he interested in this?
Siogopi kupigwa sindano, nimepigwa nyingi ati. Kazi yangu hiyo homa kazi yangu lakini ya nyumba.
How's it going? Does it feel good after he has acupuncture, right? Yeah.
Sana.
对，他用非常热情的这个话来说，非常非常好。
Just now he said enthusiastically, he said a brief, so good, bravo.
对这个病人看来已经是经常接受这个针灸的治疗。
We can see that this patient must be very familiar with acupuncture. Okay, let's go to another room.
现在这个在走廊里的这些病人都是在等待针灸科的，是吗？
The patients outside are waiting for the acupuncture treatment.
医生说的是以这个神经和这个腰腿疼痛为主。
Yes, there are many
接下来我们
have the pains in their legs or in their wrists.
好的，罗医生您好。
We are now in gynecology department. Mr. Luo is quite responsible. She often check up the patients.
这个妇产科呢，就是像刚才杨
The Department of Gynecology, just like what Mr. Yang said,
刚刚罗医生是从那个
they do not conduct the checkup during free treatment. But Mr. Luo just now helped check the patients.
时时刻刻就经常
I know that you are quite busy,
打电话叫您
and even after midnight, they may call you here.
1个月，然后
Can you briefly introduce to us about the things you've met over the past 1 month? Yes, there are combination of the pregnant women, like some cardiac diseases and hepatic failure, and also the other serious, like a massive hemorrhage and the tumor in later stage, or the infectious diseases after giving birth to the babies. Many of the diseases may be rare to be seen in China, yes, especially for the serious infection. In China, it's rare to see the serious infection for the pregnant women, but for here, every week we have 4 to 5 patients who have a serious infection.
好的，那我也知道咱们这
And the complication of the pregnant women is also rare to be seen in China, but here is quite common. We know that
下您接触到的这个生命危险的时刻大概是
some of the diseases relevant to delivery room may be life-threatening. So what are the threats to the doctors? For example, the HIV infection. This is quite dangerous to the doctors. So we always remind ourselves to calm down. We may feel very worried in our hearts, but we should stay calm. And also to comfort the patients, because the patients are also worried. And secondly, we need to protect ourselves. These are what we want to do. And you've been here for 1 month. Have you met the pregnant women with HIV? Yes. But they gave birth to babies smoothly, so I was guiding. But once we met one serious pregnant woman, he got the cesarean delivery and he got infectious. and there were massive hemorrhage. These two cases are quite serious. Have you talked to your families, to your family members about these two cases? They actually also worry about this. But when we meet these conditions, there is no time for us to worry. What we want to do is to at once treat and save the people. So after that, we may talk to our family members. So how about today's patients? Today in the gynecology, there are patients who wants to have a baby. And there are also infectious diseases and menstrual disorder. And after their description, we found that there may be problems of the chromosome. Will you suggest them to receive a further check in hospitals? Yes, because we don't have enough equipment today. We can only ask about their history of the diseases. And usually in the free treatment stations, we do not check the patients. But today, because many of them are having the diseases, we did checkup. So I check them just now. And we are now go to the Department of Surgery and Department of Internal Medicine. What are the differences of the surgery and the internal medicine department between Zanzibar and China? For the surgery department, most of the diseases are benign. And for the children, because they do not pay attention to hygiene, there are also infectious diseases. And the surgery department also see patients of skin diseases. There are so many people get skin disease here. And we can see local people really believe Chinese doctors. Yes, because there have been 55 years of history for Chinese medicine to assist here. So no matter on the streets or you are going to suburb areas, you can hear people shouting China, China. China is quite popular. Our team has been sending doctors for 55 years and get involved in the local people. So this is what called the civil diplomacy. Yes, just like what was said in the press conference, this team to Tanzania is a golden name card. This medical team is quite popular from the government to local people. For other activities, Western countries may question on that or criticize, but for medical team, this is the reputed one. And this medical team has the best reputation of the world with 0 bad records. So we will make this golden name card more and more brighter. Thank you for taking us to visit these rooms, and we can see the doctors are so busy diagnosing the patients. Okay, I will leave the time to you. Thank you. Again, We're outside the free treatment station. The free treatment has lasted for more than 2 hours, and we can see many patients are still waiting for the treatment. This free treatment is simply the first time for this 29th Chinese team, but this won't be the last. And later on, this team will continue the countryside free treatment. As the Chinese Doctors' Day is around the corner, we really want to thank the doctors working at the front line. Thank you.